And I'm going to start off by the end of it, and what does good look like? And my challenge to you was good would be that we have a societal shift in the way we prevent and treat infection with more appropriate use of antibiotics in the human and animal sector. And, I mean, I think that echoes where Ramanan is. And so what I'm going to try and talk about is how we monitor that, and about the Tripartite AMR Framework, which we are about to release. And this includes glass and other instruments, but is a broader set of metrics that really tracks how we are moving towards progress towards the Global Action Plan. And of course, this starts on the left with what countries are doing. The 194 member states of WHO who signed up to develop a Global Action Plan. And have they done that? Are they starting to implement it? Is it starting to have progress? Have they got the right systems and processes in place? And through that, we move through a range of systems, through GLASS, through the OIE system for tracking the consumption of antimicrobials in animals, through the self-assessment survey that we run as a tripartite, and through the SDG monitoring, through the monitoring of the vertical programs, pulling it all together, avoiding duplication, to get some grip on what is going on at a global level. But that needs to be complemented by what is going on in the research and development space. Are we starting to overcome some of those market failures? Are we starting to get people, money coming in and new ideas and systems working? And also it needs to feed work at the regional levels, because Europe, of course, has been a leader in surveillance and on policies with AMR, but we have ASEAN and many of the other regional economic communities increasingly getting involved and using data. We kind of think this is a bit of like a Toyota Corolla. It's not flashy, it's a basic job that does the job in many different contexts, and we hope that countries can pick it up and adapt it to meet their needs. To extend this metaphor, you can have a Toyota Corolla, but if you don't have a road network, if you don't have the systems that drive it, the fuel systems, that doesn't work. And where we are at the moment is that many countries, particularly in the non-health sectors, really lack the systems to drive this. We would hope what we're trying to is within 5 years, most countries should be able to collect most of this data. But it is going to take effort, political commitment, and investment to build those systems. And just to sort of stretch this metaphor a bit further, it's a 20th century technology. The framework we have doesn't incorporate molecular genetics. It reflects really how poorly we understand transmission dynamics, and it doesn't use big data. And there are huge opportunities with much more electronic patient information and recording to get much more sophisticated in what we're monitoring. So we would hope that this is going to be refreshed pretty quickly, and within 10 years we'll have a much better way of doing things. So we've talked a lot this morning about outcomes and how difficult it is to get representative surveillance data. So in the meantime, in the short to medium term, we also need to be tracking process. What are countries doing around infection prevention and control? What are countries doing around controlling the use of antibiotics in the human and in the non-human sector, in the animal and plant sectors? We also need to be tracking what are the key organisations doing. Are WHO doing anything useful at all? Is FAO and OIE working? Are we collaborating together as a tripartite? And what is going on in the M&E space? So it's really process and outcome measures that we need to be tracking to really get a grip on understanding where stuff is happening and where it isn't and where we need to do more. So this is a little bit of a messy slide, but I think it reflects really where we are in a messy, complex area. And for the human and non-human sectors, we need to be tracking the inputs. Is enough money coming into this? Do we have enough champions? Do we have enough people? Are the policies right? Are we starting to get convergence around standards? Are countries, what's happening in terms of activities? And then the outputs are based to the objectives of the GAP, but for example, around infection prevention control, are we scaling up wash in health facilities? 40% of health facilities in the world don't have adequate water, a clean toilet and basic hand hygiene facilities. What's happening about vaccination? What's happening about hand hygiene and infection prevention control measures? Then we need to check the outcomes and around what is happening with prescribing. Both the total volume being used, but WHO has also introduced the aware categorization. Basically, the essential medicines list has been refashioned into access drugs, which should be widely available and used in the first line. Watch, those where the risks of resistance are much higher and which should be used in second line with care. And reserve the colistins, the carbapenems that we really should be using with extreme caution. And we're encouraging countries to track that ratio. And the UK and several countries are already starting to use it. And it is a useful benchmark to start to understand what's going on. We can't set targets yet, but we can start to understand prescribing patterns and really get to grips with what is starting to happen. And then our final impact measures will be what is happening to resistance patterns? Are we still able to treat infection? And actually, what is happening to the overall burden of infectious disease? Because couching AMR in the overall communicable infectious disease control associated with quality medicines, but managing resistance is important. And so how are we doing this? We have a self-assessment survey that last year 154 member states completed. We're just finishing the third round. And this basically tracks for the human, the animal, the plant, and the environment sectors, what are countries doing? And it gives them a scale of 1 to 5, from red, basically nothing, to 5, super duper gold standard. So there's continued scope for improvement. And this is provided in an open access database and widely available. Of course, there are problems with self-assessment surveys. We can slightly validate it through the JEE, which also has an AMR component. But it's a good track record, and probably more importantly, it should be a useful basis for countries to look at and take a stocktake of where they are and where there is scope to do more. And then in terms of outcome measurement, we've talked quite a bit about the GLASS, and it's very encouraging how many more countries are signing up and enrolling. We also published the first study of antimicrobial consumption 2 or 3 months ago with 68 countries supplying data. And we are about to launch the tricycle surveillance protocol, which looks at ESBL, E. coli in the poultry, human, and environment sector to start to get some measures of integrated success. So, as I say, that's where we are. What good looks like, I will come back to, is about the way we think about the management infection and prevention. And I think in all of this, what would good look like? We need to remember that we are on a rising tide. Things are getting worse in most of the world. As we get more data, we are probably going to see the situation continuing to deteriorate. And actually flattening that curve off is going to be good, and we need to hold our nerve and get the better data and then take it forward. Thank you very much.